The areas I'm going to talk about today are really around, and this is a science perspective, a public health science perspective. So I'm going to talk a little bit about pandemic strategies. You've heard a little bit already from David about the progression of the pandemic, and I'll talk about New Zealand experience with elimination, some of the strategic choices ahead, and I think this critical need for global leadership and health equity. Just reminding you, of course, the core idea is around epidemics are more than expected. Outbreaks, of course, are localized. Pandemics are global or affect many countries. And I think this is the most profound pandemic event, of course, since the 1918 flu pandemic a century ago. So when we think about what the approaches are for or strategies for managing pandemics, you've really got this point here where, assuming that it's of note that it's not a trivial illness where you may need no strategy, you really have a choice of two approaches. You can control something which is about reducing incidence or prevalence, and we do this for most serious infectious diseases. And with pandemics, there's the idea of mitigation, which is to avoid overwhelming health services. And this is where the herd immunity model comes in. Suppression is reducing the burden, and this can be to very low levels. And it may take many years, as it has with HIV/AIDS. Now, there's this other alternative, eliminate, so reducing to zero for long periods in a country or region. And for over 20 years, the concept of elimination has been very well formulated. And of course, the World Health Organization has global elimination strategies for a number of diseases, obviously polio and measles, for example. But eradicate, so that's really reducing to zero at a global level. Of course, smallpox is the only example so far amongst human diseases. So this is expressing the same thing in relation to COVID-19. This is a paper we published in the British Medical Journal just at the end of last year. And this was our attempt to describe this typology of approaches you can take to COVID-19. And really up here are elimination or even exclusion. And there's still around 10 Pacific islands that have fully excluded this disease. They've never had cases, but it's really a form of elimination, which has been very successful in a number of countries. And the goal here is to return to this new, carefully managed new norm within 2 to 3 months. And this is what was achieved by countries pursuing this approach. Now, down here, you've got a spectrum of approaches, suppressing, as I mentioned, or mitigating. And here, the problem is that you have the pandemic still, and you have to have prolonged control measures to keep the pandemic within manageable limits. And here, you can also wind up with really widespread transmission until some form of herd immunity is achieved by natural infection, which, as we've seen, is grim. And it's still not clear that you will ever get to, well, we know now, in fact, that we can't actually achieve herd immunity with this virus, not at present. So again, just picking up on David North's points about the fact that this pandemic is still progressing globally. Maybe other people will present the same information. It's very accessible, the over 500,000 cases a day, and still typically around 10,000 deaths a day, the numbers coming down. But of course, this is a huge underestimate. And remember, this is driven by a combination of government action and viral evolution. This is not seasonality. This is something that's caused by how we've responded to this pandemic. And we should remember this year, there'll be far more deaths than there were in the first year. And David's already mentioned the fact that The Economist uses excess mortality estimates, and that's suggesting in their more recent update about 18 million deaths. It will be close to 20 million by now. But also the Institute for Health Metrics in Washington came up with an estimate which would be around 10 million deaths. So we're looking at a factor of 2 to 4 more deaths than the cases that are counted. Because remember, you can only be counted if you're tested and then you die. So obviously this magnifies inequalities because testing is only available in some countries to a reasonable extent. And this is data from the US that I thought was really quite astounding, that in the first year of the pandemic, life expectancy at birth in the United States dropped by 1.5 years. Now, that has not happened since the Second World War. So in New Zealand, our government, we've got a progressive Labour government, and they listened to the scientists and adopted an elimination strategy early last year. At that point, the country had very few cases and no deaths. And some of us were advocating very strongly for this elimination strategy. And this is still, I think, maybe the world's first published elimination strategy. And so the government actually introduced a national lockdown that basically stamped out the virus in New Zealand over a few weeks. So the elimination approach means excluding cases at the border, stamping out cases with testing, contact tracing, isolation, quarantine, and then limiting transmission in the community with measures that we're all very familiar with, masks and physical distancing, travel restrictions, and now in year 2, of course, vaccination. But elimination was quite successful, highly successful before we had vaccines. And a social safety net is also vital because some parts of our community, of course, adversely affected by the pandemic, but also by the response itself. So this was a paper we published after 100 days with no virus in New Zealand, and we're showing how transmission was rapidly ceased with a very intense national lockdown, which took around 7 weeks to fully eliminate the virus from New Zealand. So looking at the impact of elimination, this is after 18 months, and you can see that countries pursuing elimination, China, New Zealand, Taiwan, Australia, all had, this is deaths per million, all had markedly lower mortality than countries that pursued a mitigation approach, and particularly the Sweden, UK, and US. And this is not, in New Zealand's case, this isn't a small margin. This is a 400-fold less mortality if you pursue elimination. So at this point, New Zealand, if we had the same mortality as the UK or US, where 0.2% of the population has died in those countries, we would have had around 10,000 deaths. So this is what we avoided by responding very proactively to the pandemic. This is also, as many people point out, protecting public health also protects your economy. And the New Zealand economy has performed very well during elimination, and it's at the upper range for the OECD. And this is the same experience seen in other countries, that the two go together. Protecting people also protects the economy. So one of the big problems, of course, is the sustainability of elimination. And this worked very well. This is showing the epidemic curve in New Zealand for the up until very recently. And this is showing that the blue cases are people who acquired their infection overseas and were diagnosed in our managed quarantine system at the border, where everyone was spending 2 weeks. And we got occasional outbreaks. These are cases in the community. But this more recent Delta variant outbreak has really been too much for us to contain for a number of reasons. And this is showing this part of the epidemic curve in more detail. But the system we used of having short, intense lockdowns had worked very well initially, but against the Delta variant outbreak, it was struggling. And the reason in the end that it wasn't able to contain this outbreak was that the virus became entrenched in very marginalized populations where contact tracing just no longer worked for a number of reasons. And this is the feature of the pandemic globally. It's a pandemic of inequality, and this is the problem. The other problem, and it's really going back here, is that our neighboring countries have not been able to eliminate the virus, and particularly in Australia. So many of these cases were actually imported from Australia, and that's where the virus arrived from. And I think it's a key element of why you need a globally coordinated approach to sustain elimination, because it's very difficult for countries to do it on their own. So New Zealand, as of last Friday, the government has switched to what's called tight suppression, using an approach I think that will keep numbers very low, but it is to give us time to transition to being highly vaccinated, which we are doing at the moment. So where to from here? I think what are the options at a national and global level? Well, we're back to this choice really of accepting endemic infection and potentially using a suppression approach with high levels of vaccination to protect the vulnerable or protect everyone, and to minimize circulating virus. This is as we do with seasonal influenza, or progressive elimination, reducing to zero in countries and regions. And this is the model we have for measles and polio. And there is still the potential for global eradication, but that's obviously very aspirational at the moment. So just to remind you that elimination has been the dominant approach in the Asia-Pacific region. These are countries that have used this approach very effectively and are still doing so in some cases. So China, Hong Kong, Taiwan are still in an elimination state. In Australia, 5 out of the 8 states and territories are still eliminating this virus. Most of New Zealand has got no transmission, so we've got a mixed model now of suppression in Auckland and elimination across the rest of the country, which will continue for several months till we get high vaccine coverage. Singapore is proactively transitioning from elimination to a form of suppression. So these approaches are still protecting more than 20% of the world's population. So they definitely do work. Initially, in the first year, they used just public health and social measures. Now they're also being supplemented with vaccination. So these two choices, as I said, we've got progressive elimination, and we've got this living with the virus, which is a term I hate. So this is with endemic infection. So virologists have talked about what this might mean. One option is endemic mild infection, that SARS-CoV-2 joins the other coronaviruses that cause mild respiratory illness. This is thought to be very unlikely. So the more likely scenario is what we're seeing of epidemic severe infection, somewhat like seasonal influenza, but worse. And one reason is that COVID-19 is so infectious, it won't be a seasonal disease. It doesn't need winter months to allow it to transmit because its reproduction number is so high, 6, compared with a low number for influenza. In New Zealand, as in many other countries, seasonal flu is our biggest infectious disease killer. It kills about almost 2% of deaths every year are caused by seasonal flu. So when people say, oh, it'll just be like flu, I think that's a terrible benchmark to aim for because it is one of the world's biggest killers in the infectious disease area. It also fills up hospitals, and that puts a huge drain on resources. The other concern with circulating endemic infection is escape variants of concern. And we know this virus drifts, it changes gradually, but also it can have big shifts in its genetic structure and this recombination events. And this can create variants which are certainly more transmissible, potentially more lethal, but increasingly they're going to be vaccine resistant because that's natural selection is happening before our eyes at the moment. So what do we do from here on? Well, we've got these two big questions, the feasibility and desirability of elimination. So feasibility, at the moment, as we're all seeing, is it's challenging to achieve and sustain elimination with our available tools. It will get easier in the future with vaccines that give what we call sterilizing immunity, like we do for measles and polio. So I think we'll see big advances here, but we know it's technically possible. And this is where I think has been the great need with global coordination. The World Health Organization has elimination strategies for a number of diseases, and it does need one, or to at least consider one, for COVID-19. The desirability of elimination is what our government struggled with, because even though they're committed to elimination, they have become, I think, overwhelmed by the difficulty and the costs of elimination. And they're very concerned about the need for prolonged lockdowns to basically eliminate this virus in our largest city, Auckland, at the moment. And I think it's been extremely hard for them to say, look, we are going to switch or transition to suppression instead. And I think one of the critical bits of knowledge is about the large chronic effects of COVID-19. And as people have pointed out, given the emerging evidence, it may be better to think of this more like polio, where, of course, a huge global effort is in place to try and eradicate this infection. So these are the two big questions we have to really work through. So we've got, of course, a critical gap in global leadership and coordination. There have been efforts to try and reform the World Health Organization, which does suffer from a lack of resources and mandate, and has been not provided effective leadership during this pandemic. Our former Prime Minister was on a panel that looked at or reviewed their response, and their report, Make It the Last Pandemic, again, I think is aspirational and had a lot of really important messages that could be built upon. It's just reminding you about the equity problem. We all see this in so many ways. There's giant inequities within countries and between countries. And I think the most obscene one is between vaccine rollouts between Africa and wealthy countries. So finally, and in summary, the elimination strategy was certainly the optimal interim approach when you see an emerging infectious disease like COVID-19. It's partly because you don't have anything other than public health and social measures. And as a number of countries have demonstrated, these are highly effective at managing an emerging infectious disease. In year 2 and going forward, we do need enhanced tools to make elimination more feasible and sustainable. And we also need more information to assess the desirability of putting a huge resources, and this will be required. I think it is highly desirable, but to convince governments that it's desirable, I think we do need more information about the impacts of the pandemic, particularly long COVID, and the equity aspects. And we desperately need global leadership to coordinate regional and then a global response. And again, I just want to acknowledge my many colleagues who've supported me and sustained me over the last 18 months battling this crisis. Thank you.
It seems that the policy that you directed was spectacularly successful for 1 year. More than a year, you had a death toll held to 28 in the course of nearly 2 years in New Zealand. And now, based on what's we call the transition, which no doubt has taken place under conditions of enormous international pressure on New Zealand, economic pressure on New Zealand, it is very likely, isn't it, that one may see a very sharp rise in the number of people infected by COVID, certainly in the marginalized communities, and the number of people who are killed. Isn't that, in fact, the people who die, isn't that the grim reality?
That is very much so.
So I think this underscores a very basic point that's being made. Here we have a situation where you and your colleagues, and this is true, I think, for scientists throughout the world, have been engaged in a struggle. Unfortunately, they're trying to convince governments that can't be convinced. And even where, again, I want to underscore this because it's so much part of the discussion we're having today. We know, based on the experience of your work in New Zealand, and certainly in the experience of China, a country with a vastly larger population than New Zealand. I think New Zealand, you have a population of about 5 million, China 1.5 billion. And between the two countries, and it's not just a matter of averaging things out, but between the two countries, we have among both of them the lowest death tolls in the world and an infinitesimal fraction of the toll in the United States or any of the other large industrial advanced capitalist countries. So it is very troubling that you find yourself in a situation where your own projections tell you what will happen. And I think it underscores the necessity for a popular intervention to change policy. Scientists in New Zealand can't fight this alone. In fact, if there's going to be a change, it has to come on the basis of a global policy and global intervention.